Hotbed Talk.
Good afternoon, my name is Denny Levitt and I am a professor in perioperative medicine at the University of Southampton. I'm also the current president of the Perioperative Exercise Testing and Training Society, or POETTS. And what I'm going to do in the next 10 minutes or so is to give you an update on the society and to explain what POETTS' role is. So POETTS was established back in 2017 in the context in the United Kingdom of cardiopulmonary exercise testing becoming much more common in the preoperative period, such that more than half acute hospital trusts in the United Kingdom now have a cardiopulmonary exercise testing service, which is used to evaluate patients' functional capacity prior to surgery and also increasingly to direct exercise interventions to optimise patients' fitness before surgery. With a sudden and growing interest in this field, we established POETTS with three aims, essentially. First of all, to standardise education and training in the field of exercise testing and training around the time of surgery. Secondly, to develop consensus clinical guidelines to guide new laboratories in their practice in looking after patients around the time of surgery. And finally, to club together acute hospital trusts across the UK so that we could do collaborative research, which would enable us to produce data, multi-centre data, that can guide practice in terms of the relationship between functional capacity and outcomes after acute surgery. So since it was established back in 2017, POETTS has grown in size and we have now just over 400 members from the United Kingdom and internationally. In terms of what we've been doing in each of those areas, first of all, in the field of education, we've established a standardised course with standardised content, teaching clinicians how to perform and interpret cardiopulmonary exercise testing prior to surgery. This runs biannually in London, and over the last 4 years, a course has also been established in Australia in Melbourne and in collaboration with faculty at the Peter Mac Hospital. We've also run a course in Brisbane. And this year we were planning on starting courses in the United States, in North Carolina, and in Canada, in Franco Carli's department in Montreal. All those have currently been put on hold because of the pandemic of COVID. And the plans for education post-COVID, as the pandemic continues, we will be holding our first online cardiopulmonary exercise testing course in the autumn of this year. We've also established standardize accreditation for clinicians who wish to use cardiopulmonary exercise testing in their daily practice. There are three elements to this. First of all, attending an accredited course, and then essentially supervised practice, performing 25 tests and interpreting 50 tests before continuing to fully independent reporting within a perioperative CPET service. All of this training is supervised by a POETTS accredited mentor. We now have just over 180 accredited clinicians in the United Kingdom and internationally performing CPET as part of their perioperative medicine role. In addition to individual clinicians helping to educate trainees and other clinicians in their departments, there are also now POETTS mentoring sites which have been established in the UK and Australia, where there are more than 25 internationally. And these sites have agreed to provide mentoring for new laboratories, either locally or internationally. And for example, I know Torquay have recently been mentoring a centre in Hong Kong to establish the first POETTS accredited mentoring centre there. In terms of education, it's also important that practice is kept up to date, and revalidation in the United Kingdom is a compulsory part of clinical practice. POETTS suggests that at least 25 tests are reported and performed each year to maintain competency, and a revalidation process as part of general revalidation of clinical practice every 5 years. And as part of this process, peer review of exercise testing reporting is performed. Moving on, also in terms of education and accreditation, one of the challenges in the United Kingdom is there has not previously been a clinical exercise testing accreditation or qualification in the UK. And Professor Sandy Jack, who is our lead allied health professional member on the POETTS committee, has been working with the RCCP, which is a registration for clinical physiologists in the United Kingdom. And I'm very pleased to report that it looks as though they will very shortly be going to accredit a new separate clinical specialty for exercise physiologists, which will be called clinical exercise physiologists. So watch this space. POETTS has also been successful in publishing practice guidelines. The clinical guidelines for performing CPEP were published back in the British Journal of Anaesthesia in 2018 and was one of the top 10 downloaded papers that year. And this really sets out the standards for who we should test, how we should go about testing, how we interpret the clinical physiology, what are the contraindications and indications, and what are the staffing requirements for a clinical cardiopulmonary exercise testing laboratory. More recently, members of the POETTS committee have been involved in this consensus document of guidance from the Royal College of Anaesthetists and Macmillan, giving guidance for prehabilitation in cancer patients. And most recently, since the onset of the COVID pandemic in the UK, and now we are moving from beyond the surge phase, we've established guidance for clinical exercise testing in terms of safety, the necessary PPE for services which are now restarting after the surge of the COVID pandemic. And these guidelines can be found currently on the POETTS website. Collaborative research has been an important element of our work, and over the last few years we have worked together to produce more than 4 multi-centre studies looking at aneurysm surgery, colorectal surgery, the differences in exercise testing with males and females, and most recently we are currently completing a multi-centre study looking at esophagectomy patients and the utility of CPET to predict outcome after esophagectomy. We're currently analysing that data, and I'm pleased to say we have over 700 patients, 730, from 7 centres across the UK, and should be producing some contemporaneous risk thresholds in the near future. So what of the future for POETTS? Since we established POETTS in 2017, the remit has increased, and we are planning to increase the remit further to incorporate more of multimodal prehabilitation. The field has moved on, and we are all aware that exercise on its own, without optimisation of nutrition and psychology in terms of behavioural change, is unlikely to be effective. And so we have increasingly been involved in multimodal prehabilitation, as you can tell from today's POETTS programme, which is focused very much on the current status of prehabilitation from a clinical perspective and also from a funding perspective in the UK. In order to establish the role of POETTS in prehab as well as exercise testing, we are going to be welcoming some more members onto the POETTS committee. John Moore from Manchester, who is the clinical lead for the Prehab for Cancer programme, and also Zoe Merchant, Catherine Neck and Rachel Barlow, who will be helping to develop educational guidance, clinical guidance and collaborative research in the field of multimodal prehabilitation. So the plans going forward for 2020 and 21, first of all, from the education perspective, to establish the online cardiopulmonary exercise testing course, and also in autumn of this year, an exercise prescription for clinicians course. In terms of guidance, there is an immediate priority to provide physical exercise advice and guidance for patients who are self-isolating prior to surgery during the COVID-19 epidemic, because they are no longer able to go out to visit gyms and we need to think of appropriate exercise guidance for patients who are housebound. And in terms of collaborative research projects, there are two new projects that we are establishing currently. First of all, led by John Carlisle from Torquay, a validation of his mortality prediction model in contemporaneous aneurysm patients at multi-centres across the UK. And if you're interested in becoming involved in this patient cohort, please do contact us via the POETTS website. And also, importantly, again, within the COVID crisis, where access to cardiopulmonary exercise testing or other types of face-to-face exercise testing may be limited, we will be establishing a validation of the Darcy score against cardiopulmonary exercise testing variables to try and identify thresholds of risk in contemporaneous general surgical practice. And finally, we are continuing to establish the national database, which will be held at the Royal College of Anaesthetists within the National Institute of Academic Anaesthesia. And I'm very pleased to announce that POETTS has been recognised as a specialist society this year by the National Institute of Academic Anaesthesia. So in summary, a lot of progress in the past year and an expanding field, which is exciting with the advent of multimodal prehabilitation. We look forward in the next year to new research projects and new educational challenges in the online environment. If you are interested in becoming involved in any of the collaborative research projects, please do contact us. Our contacts are here on this slide or via the website. We would be very pleased to welcome more centres, and anybody wishing to join POETTS, you can join via the website. It is currently free to join the society, although we will be introducing minimal subscription within the next few months. And if you wish to find out further about accreditation in POETTS, that's also available from the website. Many thanks.
Top Med Talk. Thanks for downloading Top Med Talk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, Top Med Talk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.